lived experience and work in the field or not, but we all come with a special or a specific issue around diversity and inclusion. Okay. And because of that, that's our area of expertise. But the reality is, we really need to become experts in a lot of different areas. At least we need to become aware of them. Otherwise, we're not going to really be effective when we're talking or helping to bring awareness to other folks. So it's because of that, I thought maybe I could just highlight some of the issues that I've come to understand that intersect with the addiction and recovery communities when it comes to inclusion and diversity and equity issues. So, and please, by all means, if you have questions or comments or anything you want to interject, feel free, because again, it's not a formal presentation. I did put some slides together with some thoughts I wanted to remember to kind of keep us moving forward. But please feel free to interject if you have comments. And I just put the the mission of the Inclusivity Caucus on here just to remind us of why we're here and how, again, this work intersects with the addiction and recovery communities. And if we want to co-create and strengthen safe spaces for folks of all races, ethnicities, genders, sexual orientations, languages, socioeconomic status, ages, and abilities, right? End discrimination, disparities in care, and remove systemic barriers to all who seek support. Lofty goals. It's real important that we all kind of are aware of what that means, right? And that might mean different things to different people. And so I'm so grateful Carol mentioned that we're going to have the Google Classroom, the space to place resource material, because obviously there's no way we could learn everything we really need to learn about all these areas, about sexual orientations and genders and languages and socioeconomic status. We just don't have that kind of time or bandwidth to do that many trainings, but we can share information about those things and send people to learn more about them, and things that we think are really quality trainings or quality information we can present to our larger group. So that is that. And of course, when I talk about common goals, I talk about the Inclusivity Caucus as a group, right? And then, of course, the subcommittees, and I just listed the ones that were on the document that Carol sent us in terms of proposed subcommittees that folks had expressed an interest in being a part of. And so for me, this group is charged with highlighting and educating ourselves and others about the intersections of race and nationality and ethnicity and genders and gender identities, socioeconomic status, all those issues in relation to how they fare in the addiction space, in the mental health space, in the recovery space. So whether you're on the housing committee, for example, or the social justice committee, or the Legislation and Policy Committee, it is my thinking that while you're developing advocacy points or issues that you want to highlight and train folks on or advocate on, that you're keeping in mind issues around diversity, equity, and inclusion, and how they intersect with those issues, if that makes sense. And the Fab 15 of diversity is a slide I found that I really thought was cool, because as we said, it could be so many different things. And of course, we can't become experts in all of those things, but we do have expertise of our own. We have our own experiences. We have our own culture. We have our own understanding of language. And hopefully, cultural competence and cultural a cultural humility talks about the fact that you're not going to become an expert in all of these areas about everyone. But first of all, we want to honor that our differences and understand that because we come from different cultures and different backgrounds, that we have different needs. And we can't assume that everybody thinks like we do, even if we have the common bond of addiction or mental health or trauma. That still manifests differently based upon, for example, some of these areas. And that's the reason I put that up there, to get us thinking about that. Age, of course, religion or lack of religion, those are issues that we might want to think about in terms of how we advocate for folks. And of course, everyone's talking about social determinants of health. Some of us may know what that means. All of you may know what that means, because in your work life or in your personal life or your volunteer life, you may come up against those clinical type terms or those public health type concepts. But it's really important that we keep in mind that one of our goals, particularly around wellness, for example, is that we can't talk about wellness unless we're talking about these social determinants and how they manifest, and how they manifest differently in different cultures and different communities. So, for example, even the disease of diabetes, which happens to be very prominent and prevalent in the African American community, there's a lot of things that go into why that is and how that manifests. And so therefore, how it's treated and whether or not people go to get treatment and how they respond to that treatment is a reflection of all of those social determinants: where they live, their economic factors, what their diet is, what their history, their generations prior to them, how they handle those things. Economically, their education, their environment, their employment, obviously, all of that plays a part in the effects and the outcomes people have with all kinds of health issues and other things. So that's just another thing we have to remember, and it's an issue that is really. I'm grateful that we're talking about it these days, but I've noticed when it comes to policy, sometimes it gets lost. I notice it starts out with remembering those things, but when the policies are written and it's time to implement them, we see that those social determinants affect how they're implemented and how well they manifest themselves. So. And in terms of racism, obviously, a lot of our social justice issues that came up in this past year focused a lot about the structural racism and the individual and interpersonal racism in our country, and the issues around law enforcement and the issues just around our social interactions, the Karens and all of that. And we have to remember that all of that affects the folks we work with and for and on behalf of, and ourselves as well. I know when I was, I'm also a certified peer recovery supporter in my state, although I don't work in that field right now. But in just talking to a group of peer supporters in the middle, like say in the summer, when things were really, really the height of the George Floyd issues and the protests and the Black Lives Matter protests, and I talked about we were asking folks how they were feeling, how the peer supporters were feeling, and how were things going, and with all the social unrest, and how were they engaging with their clients. And this is a diverse group of peer supporters: Black, white, young, not so young. But most of them, as a matter of fact, all of them expressed reluctance to talk about these issues because what they were afraid, whatever mental health agency or whatever agency they worked for, they didn't want to get written up because they were afraid their client might complain about them, or if they were not of the same race, they were afraid they would offend the person. And it was And it wasn't just white peer supporters, it was Black ones that didn't want to bring it up either. They wanted to keep their personal beliefs and they wanted to keep everything completely out of their interactions with their peer supporters. And that really concerned me, because one of the tenets of peer support is walking folks through their recovery process, right? And using your lived experience to help them with that. Well, first of all, any individual who is a person of color, or gay, lesbian, any of those historically marginalized communities are going through something during this this heightened time of social unrest over the past years, right? And so of course their recovery is affected. And so if we can't talk about it in a comfortable, supportive way, then we're not really doing our jobs. That's how I feel about it. I don't think you can do your job as a peer supporter, walking someone through their recovery, if you're afraid to talk about a very real part of all of our lives, regardless of your color, regardless of whether you're gay, straight, regardless of the community you come from. So we felt it was real important to start having those conversations. So that's an example of how when you advocate around recovery supports, for example, it's important that you advocate that those recovery supports are presented and utilized in a way that is culturally responsive. And of course, we're talking about healthcare and disparities, and the differences like between disparities and health equity. And this slide just talks about, this is a study that said that 67% of doctors have a bias against African American patients. And of course, this bias is not necessarily explicit, right? A lot of that bias, much of it may be implicit. And research has also shown that one of the reasons that opioid use disorder was thought for a long time to not be as prevalent in African American or communities of color was because doctors didn't prescribe those medications to people of color because of implicit or explicit biases about their ability to withstand pain, or things like that, or their potential for abuse of those prescriptions. So we have to keep in mind the impact of disparities on different communities, and when we're advocating for recovery services, recovery support services, and treatment services, and even harm reduction services, we have to be mindful of implicit bias. And if I had enough time, there was a really cute little video I found that illustrated implicit bias in a really, really kind of poignant way that made me go, oh, but I didn't have time to, but I definitely would like to share that with folks in our classroom, because I thought it was really great. And so again, disparity versus health disparities versus health equity, and what that means, and how health equity is what causes the differences, the disparities that a lot of communities experience. And and that's one of the main things that we've got to remember. We've had to learn over especially the last year or so, but over the last few years, as the opioid crisis highlighted the public health issue that is addiction, that equality doesn't mean equity. Right. And so the civil rights movement focused on equality, but that doesn't necessarily mean that everybody got what they needed. And so, of course, when we're talking about equity, we're talking about everybody getting what they need to be successful. So it's the outcomes that matter. Certainly equality is important, but it doesn't, especially when it comes to individuals in recovery or seeking recovery, equity in healthcare is what we're shooting for. And so that's something that I just don't believe folks understand necessarily unless they work in this field. And so the folks that hold the purse strings, the folks that create the laws, we might need to focus on assuring that we are, highlighting the intersection of these issues when we're talking about advocacy. So when we talk about social justice, we're talking about equity, access, participation, and rights. And guess what? These are things that we talk about, when it comes to the recovery community. So again, they're intersections, and so we understand, I think, a little bit more about what we're talking about. But we also are charged with bringing other folks to that awareness, right? So that's the important thing. And I added this slide because I found this. Ohio, our governor created a recovery task force that created a minority strike force when the pandemic hit, and we learned, as we now know, that things like pandemics and health care in general, affect communities of color particularly harder, right? So the pandemic has affected BIPOC and communities of color in much more devastating ways because, again, of those social determinants of health we talked about, right? And so these things, these bullet points here are things our governor has tasked the Minority Health Task Force and our Recovery Ohio Advisory Board to put into practice to kind of address some issues, particularly around the social justice issues that have been happening, because we've had some major issues here in Columbus, Ohio, over the past 6 months, that have devastated us. And our chief of police had to step down and things like that. But I thought it was amazing that they talk about really amplifying the voices of racial, ethnic, and other historically marginalized communities, and improving law enforcement training, transparency, and accountability. And this is the one I love. Criminal justice reform includes innovation in recovery and addiction services provided to incarcerated individuals, and transforming the pardons and parole board processes to enhance transparency of the board process and diversity among its members, which that blows me away, that they're finally talking about transforming the pardons and parole board processes, which obviously are affected by, systemic racism and all of those other isms, just like the rest of society. So I just am happy that they're at least putting it on paper. Now, of course, we have to see how that transforms into action, but that's our job, right? Just to make sure it happens. And so really quickly, stigma. We all know what stigma is, but we have to be mindful that stigma manifests itself differently in different communities, right? Leanne, you mentioned how communities of color are treated, and with regard to the opioid epidemic. And look, there's a lot of Black folks particularly, but other communities of color as well, that are still seething over the fact that, it was criminalized in the 70s and 80s when it was crack, and now it's a health issue. And hey, we all know it's a health issue. We knew it back then, right? But we're grateful that they finally, saw the light. But the realities, when we hear sometimes when they're talking, when folks are talking about the devastation of their families and how their kids were fine until they broke their ankle and started, using. And I read, and even when we read about Big Pharma and the role that they've played in perpetuating this crisis, it's amazing how nobody talks about how the government perpetuated crack in communities of color. We don't talk about that the way we talk about Big Pharma. So obviously the stigma, because of that, it keeps us from seeking treatment. It keeps us, which is one of the things I fight for, it keeps us coming to the table to advocate, right? So I have a big mouth, right? I'm looking for other big mouths. I don't need to be the only one in the room. I don't need to be the only, Black face in the room, or the only Black woman in the room, or the only person in recovery in the room, right? I need others, but sometimes we're not at the table. Sometimes we're not invited. I've heard folks say the reason that we're not there is because we invite them, but they just don't show up. There's all kinds of reasons. So stigma manifests itself differently in different communities, just like folks who are differently abled. And I have a picture of a person in a wheelchair, but of course we know all those issues aren't visible. Some of them are invisible. We've talked about that, right? It's part of our inclusivity conversations. But that means the stigma around addiction and getting treatment and seeking recovery support services manifests differently in those communities. And we have to be aware of that when we're advocating for recovery supports or harm reduction services or treatment services. And again, transgender women, the LGBTQIA plus community, stigma is alive and well and manifests itself differently in their communities. So we have to be mindful of that. And so that means we have to be educated. We have to educate ourselves about what some of those issues are, because I can't represent the transgender community. I can't represent the LGBTQ community. I can only insist that folks from those communities be at the table with me. So finally, action, right? I'm an action person. I believe we need to have the conversation. We need to talk about training. But after we do that, what are we going to do, right? So you see, I have a what's next there. That's what we're here for, right? That's what our committees are for, to decide what we do about these issues and how we help our community thrive and how we educate the general public and we educate the Recovery Advocacy Project staff and participants and mobilize recovery folks and anybody else who will listen, the legislature, both in our local communities and nationwide. And finally, anybody, we didn't get a lot of chance to conversate through this presentation, but of course we're going to continue to talk. You're welcome to email me or call me anytime if you want to chat, if you have ideas or you think, I missed something or I need schooling on something. I'm a pretty flexible person, even when I'm always right. I'm willing to listen. So I appreciate you guys listening, and feel free to make any comments or questions at this time.